Hello and welcome. I'm Katrina Pratt Roebuck, and I am the founder and CEO of Uplifme. And Uplifme is a resource site for folks to find social service events happening across the country. We also highlight the great work of community-based organizations that do work in their communities every day and that addresses social determinants of health. So today I have here with me Karen Pollack, and she is the Executive Vice President for operations and programs for Maternity Care Coalition. So Karen, welcome. Thank you for being here.
Thank you. It's great to be with you.
So Karen, can you start off by telling us what the Maternity Care Coalition does?
Sure. We're an organization that's been around for over 4 decades. And every year we work with hundreds of families in Pennsylvania and Delaware. And we provide a variety of services focused on supporting pregnant people, infants and toddlers, and their families. And we do that through home visiting services. We provide child care services. We do community and parenting education. We have services, doula and lactation support services, and behavioral health services for that population. We also
Okay.
have a really robust research and evaluation department and advocate for families at the local, state, and federal levels.
Okay, that's amazing. So the work that you do, I think I thought it was primarily around supporting women in terms of their health care and in delivering their children. I didn't realize that you guys also supported families beyond a mother who is pregnant, and didn't know that you guys provided behavioral health services. So that's really interesting. Can you talk a little bit more about those services that you provide? And I noticed in your website, you also talk about addressing the social determinants of health. Can you talk a little
Sure.
bit about those services?
Happy to. So I would say that when our perspective is that in order for there to be a healthy mom and a healthy baby, there needs to be healthy people surrounding a mom and a baby.
Mm.
And that when a baby comes into the world, it's not just the parents or the primary caregiver. It is really a village that
Mm.
surrounds the child, and whoever connects and is in that child's life and in that pregnant person's life is somebody that we want to engage in supporting the entire family. One of the things that we also have recognized is that, as you mentioned, the social determinants of health are areas that also impact an individual and are things in their social environment, whether it be access to housing or food or other ways of meeting their basic needs. It could be around financial security. It could be other transportation, other issues in their lives that may impact their ability to be healthy and their overall well-being. And one of those issues is access to behavioral health services. And so one of the things that we realized is that people who are pregnant or have just had a baby, it's really hard for them to get out and get to a therapist's office or join a group or another community support entity. And so what we've done is we have employed behavioral health specialists. So we employ therapists who provide in-home therapy to people who are pregnant and families with young children. It could be family therapy, it could be couple, it could be parent-child, and we do that in the family's home. And that really breaks a lot of the barriers that families face in accessing services.
So can you talk to me about who then comes to the Maternity Care Coalition for services and how long you engage that person and or that family?
So basically, most people come to MCC when there's a pregnancy. And
Right.
so either the pregnant person or a close family member will connect with us. And sometimes a person comes when they already have a baby, but we
Mm.
really like to engage with families as early in a pregnancy as possible. And that's in order to provide the most amount of support that that family needs. We have a whole team of community outreach specialists. We call them our community engagement specialists, and it's a very robust department that goes out to health fairs and clinics and other places where people who are pregnant may be, and in order to connect with them and to engage them in our services. Sometimes we receive referrals from providers in the community, either healthcare providers or other social service providers. And sometimes people find us because they get online and they Google and are looking for help because they're pregnant or have a young child, and they reach out to us that way.
So can you talk to me a little bit about that initial engagement? And you said that folks can be referred to you from other organizations. What would trigger a referral to MCC? And then also what would, we'll start with that one. And then I also wanted to ask a follow-up question around if a person is pregnant and doesn't know sort of what you offer, how you're engaging them. Do you do sort of like a holistic assessment to see all the things that they might need? So you could talk a little bit about what triggers a referral and how you assess to provide folks with the services that they need.
Sure. So sometimes people are referred to us because they have unmet needs. So
Okay.
maybe they're, they're feeling overwhelmed by a pregnancy.
Mhm.
They don't have the basic supply. They don't have enough food. They have unstable housing. They're
Mhm.
feeling overwhelmed by their pregnancy.
Mhm.
Maybe, it's not their first pregnancy and they have other children. They have unmet child care needs. So
Okay.
really, sometimes people will reach out because there's some type of unmet need. And sometimes it's a first pregnancy and they're just kind of, not sure about parenting and kind of overwhelmed with the idea of being a new parent, becoming a
Mhm.
mom, becoming a dad, and what that might be like. And so a lot of times when we first engage people, it's really just making sure that those basic needs are being met. So if you remember Maslow's hierarchy of needs,
Mhm.
right? It's that bottom level of that pyramid of really wanting to make sure people have the things that they need. And sometimes the things that they need is information.
Mhm.
They
Mhm.
may need education on good nutrition during pregnancy,
Mhm.
or how to stop smoking during pregnancy, or the benefits of breastfeeding. And
Mhm.
those are all things that we can support families around. Um,
That's, I'm
to
sorry,
your
go ahead.
other question, yeah, to
Mhm.
your other question about our first, how we kind of gather information about the family. If somebody enrolls in one of our home visiting programs, we do a really comprehensive assessment. We ask
Okay.
lots of questions about the client's health status. We want to understand their kind of social
Mhm.
environment, their living environment. And really what we want to do is hear their story. We spend time getting to know the family and really trying to understand what their story is
Mhm.
and how we can be most helpful.
Okay, that's fantastic. I think it's wonderful that people can come to you with concern and then also have access to an array of services. Um, can you talk about Black maternal health? You know,
Yeah.
that's something that is really, unfortunately, seems to be overwhelmingly impacting Black and Brown mothers. And so can you talk a little bit about what MCC does in that space to support Black and Brown mothers?
Yeah, I'm really grateful that you raised that issue. I think it's something really important that we talk about. Um, there's a concept in healthcare and public health called racial disparities.
Mhm.
And what research around racial disparities shows is that Black and Brown individuals have, in many different areas of health, have greater challenges than other racial populations. And outcomes in maternal health are one of those areas. And what that means is that, in particular, Black women are, Black birthing people are more likely to have a significant health issue that arises during a pregnancy, what we call a maternal morbidity,
Mhm.
or unfortunately, experience a maternal mortality, which is Black women are 3 to 4 times more likely to die during pregnancy and in the year after birth.
Mhm.
And it is a tragic situation that is has, there's been lots of work that has been done over many years to try to address these racial disparities, and unfortunately, it's getting worse. And what we know is that the maternal mortality, particularly for Black women, but even overall, is worse in the United States than it is in any other developed country in the world. And so this is an issue that is particular to the United States and is unfortunately particular to Black and brown women.
And can you talk a little bit about that? So I did know that, historical racism has played a part in every aspect of Black folks' lives in this country. And so, Black maternal health being one of those issues in terms of disparities showing in that way. Can you talk a little bit about why those disparities are so prevalent in the US versus other countries that might have the same economic status? I'm sure that, racism, structural racism has a lot to do with it, but can you go a little bit deeper as to why in this country is so much more significant, or is the bottom line that it is, a tie-in back to historical racism and current day racism?
It is connected to historical and current day racism. And I can give you an example. I think there are, when Black folks go to a hospital or interact with a healthcare provider, they may experience implicit bias. And so that is when a healthcare provider unknowingly and unintentionally will view that patient differently than they might view a white patient. And I've heard stories. One of the things that I do in my role is I serve on the City of Philadelphia's Maternal Mortality Review Committee. And so we review all of the deaths in the city of Philadelphia in order to try to address some of the disparities and make things better. And one of the things that we look at and examine when we look at those cases is whether there might have been an incident of implicit bias, whether a healthcare provider might have minimized symptoms, including pain symptoms. And so the structural and institutional racism is so ingrained in this country that I think oftentimes we don't even think about it. Well, I would say white people don't always think about it. And so I think that it's important to engage healthcare providers in addressing some of these issues. And my experience on the Maternal Mortality Review Committee has been that they are open and interested in making things better. I also want to say one of the things that we do at MCC is we have a really comprehensive doula program. We train doulas who are labor support individuals. They're non-medical folks who will come in and be present during a birth and really work with a birthing person to ensure that they are that their wishes are being highlighted and that any concerns that they have are being addressed. And we train doulas and we match individuals who are interested in a doula with a trained doula.
So I think that what I'm learning in what you're saying that I was not aware of around doulas is that doulas can also be advocates. Is that what I'm hearing you saying, that a doula's role is not just, I assumed it had more so to do with supporting a person through their delivery. So a doula has a role that they can play in advocacy. Is that as well? Is that what you're sharing?
They do serve as advocates, and if there's something that's happening during the birth that the birthing person wants to have be different, as long, the doula can approach the healthcare providers and speak to them about it, obviously they're not healthcare providers and
Mhm.
they're not making medical recommendations, but in terms of that birthing person's level of comfort or ability to be in a particular position, to be able to move around, as long as it's medically okay to do that, they can certainly advocate for that.
Okay. I have one more question, because this is such an important topic. How can Black women, what are some of the ways in which Maternity Care Coalition advises or supports Black women to advocate for themselves? What could folks learn today about what Maternity Care Coalition can help support or advise folks in being empowered to advocate for their own care?
Yeah. One of the things I want to mention is that our staff are what we call lived experience experts.
Okay.
They're individuals, they're community health workers, so they
Mm,
are
mm,
familiar with the community, live in the communities, speak the language of that are spoken in the communities that we serve.
mhm,
And they, many of them have children, have grandchildren, and have had experience themselves that such as what we're discussing today. And I think that we call them advocates. We call our
okay.
staff advocates. They're our home visitors, and they're really trained, but can also speak from the heart in
Mhm,
helping women feel comfortable asking questions. And I think oftentimes many of us go into a communication with a healthcare provider and assume they're the expert, and we shouldn't be questioning or asking questions.
mhm,
We shouldn't be questioning their decisions or asking questions that we have. And I think being, recognizing that each person is the expert in their own body
yeah.
and has the most information, and really being able to feel comfortable taking the time to ask questions.
That's helpful. Thank you for delving a little bit deeper into that. I really appreciate it. I think it's going to be valuable for folks to know that there are doulas that act as advocates, community health workers, the role that community health workers play, the role that people with lived experience play in this work, I think is very important for folks to know. So can you tell me a little bit perhaps about something that folks may not know about Maternity Care Coalition that you think is important for the public to know?
Um, yeah, I think that one of the things that we do at MCC, and it goes along with some of what you've previously asked, is one of the things we really like to do is to hire people who were clients of our organization.
Okay.
And in some of our programs, that's kind of a mandate that comes
Mm,
with the types of services that we're providing, but we really feel like enhancing lived experience experts, including people who have already interacted with our programs, they're the best advocates for clients because
mhm,
they have been there themselves.
mhm. That's great. Um, so can you talk a little bit, and I know I'm asking you probably a lot of questions more than I anticipated asking you, but I think that this subject is so important. Can you talk a little bit about Maternity Care's Coalition's role in working with healthcare providers? Does MCC speak on this issue in terms of trying to support the health systems or medical professionals around implicit bias or around the issues that are causing the disparities for Black women? Does Maternity Care Coalition have a role in engaging folks in that way?
We do, and
Okay,
we do that a lot through partnerships.
okay.
We have lots of partnerships across the regions that we serve,
Mhm,
and a lot of those partnerships are with healthcare providers. We have some places where we're co-located, where we're working
mhm,
very closely with healthcare providers, usually obstetricians and
mhm,
midwives in kind of prenatal clinic settings. And one of the really important outcomes that come with that co-location is the fact that we're able to share information with permission of any client who is enrolled in our program, but we're able to share information with healthcare providers around those social determinants of health that we talked about earlier. So a healthcare provider doesn't really have any sense of what's happening for a particular individual once they leave the doctor's office. And all of that stuff that goes on in a client's home, in a client's neighborhood, in their community, really has an impact on their health and their well-being, even their ability to get to an appointment. You know, I've had the experience of doctors getting frustrated when a certain individual isn't able to make a particular appointment or doesn't follow through with a recommendation. And having them understand why that may be true, that maybe it's about employment, maybe it's about childcare, maybe it's about transportation, and not just that a person isn't interested in following through on their doctor's recommendations, but really that there's something else going on in their family's life. And so one of the ways that we're able to do that is through those partnerships where we give the healthcare providers a bigger picture about what an individual may be experiencing and why, so that it may help them to understand some of what's happening in their office. And then I would also say vice versa, right? So the doctor is able, sometimes we're present during doctor appointments, and our staff are able to help reinforce information that a doctor is sharing or a healthcare provider is sharing, and to be able to support an individual in following through with recommendations.
That's great. That's great. Thank you for sharing that. Can you talk a little bit about what MCC is planning, perhaps over the next year or two, that you think is important for the vision and direction of the organization?
Sure. So we are just about wrapping up a strategic plan. And so that's a really great opportunity for us to think big and really take a minute to think about what we want to do next. One opportunity that I would love to mention is a grant that we recently received from the Pennsylvania Department of Human Services. And that's a grant that they had called the Women's Services Grant. And this opportunity is allowing us both to expand geographically into some new communities that we hadn't served before, but also to strengthen relationships with healthcare providers to ensure that women of all ages are able to access reproductive health services, including health screenings. And so we're kind of enhancing our relationship, including specific and direct referral relationships with healthcare providers who can do screenings for ovarian cancer, screenings for breast cancer, STI and HIV screenings. And so we're really excited about this program that's going to allow us to kind of broaden our scope and be able to help women in whatever stage of reproductive health care they're needed.
That's fantastic. I appreciate that MCC is helping folks both for their physical and behavioral health needs, also addressing social determinants for their home situation if that's necessary, and that also you are in spaces, right? You talked about being a part of the committee that reviews fatalities, and you having that space to really help understand and then also to advocate. And I'm assuming that the work that you all do also feeds into policy making. And I think that all of that's important because you have the folks on the ground doing the work every day, right? And so I think it's really important and helpful that you all are in all of those spaces. So really, really impressed with the work. I really appreciate you coming on and talking to us about that today. Want to know how the public can support MCC. Can the public volunteer with Maternity Care Coalition? Can the public donate to your causes? Can you talk a little bit how the public can support MCC?
Sure, I'd love to. We love volunteers. We have opportunities for internships and other ways of giving back, as well as, of course, accepting donations. And that can all be done through our website, which is Maternity Care Coalition, one word, .org. We just updated our website. So if you are able to look at the Get Involved tab that's on the homepage of our website, it lists lots of information. There's also a Contact Us tab at the very top of the website that gives our phone number and our email address, which are also ways to be able to connect with us either as a volunteer, a donor, an intern, or a client.
Okay, that's great. And we will include information in the notes of this program on the link to MCC, as well as a link to the donation page specifically. So, Karen, thank you so much for being here with us today. Really appreciate everything that I've learned, and I'm sure the public will also feel the same way. Thank you so much for your work.
Thank you.